Great. Well, hello and welcome to the Sweaty Scientist podcast. On this podcast, we explore the intersection of science and running. And joining me this morning for episode 104 is Beverly Yang. Welcome, Beverly. Good morning.
Yeah, glad to be here, Steve.
Well, great. Thanks a lot for joining us. Maybe we could start out, just tell us a little bit about your background, you know, work, education, and then maybe take that into, how you got into running.
Yeah, so I'm Beverly. I'm still very early on through my professional career. I came from Shanghai, China, and I came to the States for high school and college. So I'm a chemical engineer by training, but I have done a lot of biochemical engineering research throughout my college. And after graduating college, I'm mostly focusing on my role in biotech operations. So did a little bit QA validation, quality control, manufacturing, especially in cell and gene therapies.
Hmm,
So my current work at Vertex has mostly focusing on our type 1 diabetes program.
sure.
So my role is to mainly focus on resolving manufacturing issues, optimizing some of the manufacturing processes to ensure smooth operation of such a complex system and hopefully to bring the drug product to the market.
Yeah, no,
Yeah.
that's a really critical part of the drug life cycle, if you will, from discovery R&D and then into production, and
Hmm.
making sure that you not only have an effective product that will help address that type of disease, in this case, type 1 diabetes, but it's also safe, and that's a really, really critical role. And certainly love to learn more about that. But as I also understand it, you have two master's degrees, one in chemical engineering, another one is in data science. Is that correct?
One is the one I'm currently working on, computer
Okay.
science, because AI and Gen AI has become such a huge things across, the whole biotech industry, especially cell and genes, and also the manufacturing as well. And the biotech historically, on the manufacturing side has been slower than the other like automobile, other industry in
Mhm.
terms of like catching up to the AI speed. So I think it's kind of augmentative to what I'm currently working on. So that's the current degree I'm slowly working towards.
Oh,
Yeah.
great, great.
Yeah.
Yeah, I mean that's I think you hit on a real key issue, which is just the adoption of AI. It's just
Yeah.
permeated all aspects of our lives and everything that we do on a professional basis. And the rate and pace of change of new models that are entering the space is absolutely incredible.
Yeah, it's truly
Um,
incredible. Yeah.
Yeah, I would really like to understand kind of how it's affecting your job. Maybe you could tell us, and we're going to flip-flop this episode because generally we spend a lot of time on the running and a little bit of time on science, but I think you have such a fascinating role in the pharmaceutical industry that I'd like to hear more about that, and particularly the conjunction of AI and how that's impacting your job. And specifically,
Mm,
how are you ensuring that these drugs are safe, right?
right. On the development side, on the clinical side, we haven't, I might be wrong. We haven't used that much AI. We use a lot of design of experiment, a lot of tradition methodology of solving the problem. And personally, I'm not the scientist, so but I'm hearing a lot of things around adopting AI for future experimentation, especially on the process improvement part. We still using a lot of design experiment, trying to eliminate the variable and try to eliminate variables within the within different parameters. On the, I think tech ops side, there's a potential of using Gen AI to write up such as like deviation reports.
Mm.
A lot of routine repetitive tasks can be potentially replaced by um, Gen AI, and we do have that capability. And being we're in the testing phases to see how that will support our operation. And a lot of work, I don't think can still be replaced by Gen AI yet because a lot of clinical operations have so much data, but also all ever-changing data. So part of the AI job is to find patterns like human, but they do like bazillion times faster. It's trying to find pattern and then try to identify the problem and prescribe a solution to it. So again, it's still like a budding phases, and we're still in the data gathering stage
Hmm.
at this point, but I'm very excited to see how it will be potentially be used into more of a clinical GMP operations and a commercial. And I know FDA has established some new AI guidelines for the past 2 years, so it's still brand
Yeah.
new arena for us. But again, we're still in a experimenting phase, trying to test it out what works the best. So
Yeah. No,
yeah,
that's super interesting because you think about all the paperwork that you have to fill out in the FDA
yeah,
environment, right? This is a highly regulated area.
for sure.
And your reports and how you fill out those reports, I'm sure, are prescribed by the agency, certain mandatory fields that you have to collect.
Yeah.
And to your point, this may be just a area that's ripe for automation through AI, being able to collect that raw data and just saving just tons of man hours.
Yeah, we're still trying to focus on more the digitization part. Even like
Mhm.
right now, there's still a lot of paperwork, like you said, like the manufacturing batch tracker and QC have their form to fill out. But now we're kind of aligning the manufacturing side is also aligning towards more of development side use like electronic batch tracker and trying to digitalize as many processes as we can um, so we can get more clean data.
Mm, yeah.
Yeah. So yeah, it's
Yeah.
pretty exciting field.
Yeah, very, very exciting. I think it's one of the maybe not the area of AI that gets all the glamour, the glitz, the spotlight, if you will.
Yep.
It's that kind of that unglamorous stuff, but it's such a central, critical function, and it's one that absorbs just a lot of man hours. I call it this the picks and shovel version of AI, right? Because
Mm,
this is kind of like if you look back at the gold rush era, the people that really made a lot of money were the merchants like Levi Strauss that sold the picks and the shovels and the Levi's, the jeans that the
hmm.
miners wore versus those that struck it rich, right? And that's kind of this version of AI is that mundane stuff that just by freeing you up to do something else can save just a
Exactly.
ton of time and money, et cetera, cost. And that's another cost that's in the cost of pharmaceuticals. And people don't realize, they look at how long it takes for a drug to get to market. Well, part of that time is just regulatory cost, right? Just the
Yep.
the absolute mass of paper that pharmaceutical companies float on. If we can reduce that, maybe we could speed up drugs to market. So I think it's critical. Can you talk
Absolutely.
about what company you guys use, or is that if that's confidential, no problem. But there's companies,
You mean the software
yeah, the software,
or
the AI
ooh,
software.
we have a lot. So
Mm.
um I don't think I can share the name,
And that's fine.
but
That's
yeah,
yeah,
but we
no
use
worries.
LIMS,
Yeah,
MES, so manufacturing
mhm,
execution system,
yeah,
laboratory information management system, pretty much everything we can use. The
yeah,
software we try to digitize first and use their
mm,
internal capability because a lot of company they offer the AI solution by themselves, so they offer like whole package.
gotcha, gotcha.
Yeah, so it really depends on the division as well,
Mhm,
very interestingly.
mhm,
So each department as well will have a different choices. So
mm,
a lot of time it's
yeah,
hard to align on what platform we use across the board. That's yeah.
yeah,
And I try to connect, making sure data is not siloed throughout different platform. That's another
yeah,
challenge to record data and utilize data.
yeah.
Um, so
Yeah, yeah, I didn't think about that. I would think a
yeah,
company like Vertex, that everything would be kind of uniform, right? You'd be
yeah,
driven
that's
down.
yeah,
But having each department find their own solution is maybe perhaps a little bit costly as well if you have different
yeah,
departments doing different things. And yeah,
yeah,
but anyway, let's turn to running. Tell us about how you got into running because I think we covered a little bit of this ground during our initial call, and
yep.
The reason why it resonated with me is because it was kind of like my journey, because I hated running when I was younger, but
Same.
I'm still in your thunder. Tell us a
Yeah.
little bit about your journey.
So I started running during high school, but before coming to US, I'm not athletic at all. I'm still not really athletic, but I just don't like running on track. It feels boring and short and takes a lot of energy. So
Mm,
when I get to the high school, um, at the time I'm trying out different sport. Running is one of the last item on my list, but unfortunately I have just fair share of unlucky events with all the ball sports. I'm just not adapt to it. So, and at the time, I think I had to join some kind of sports club
mm,
just to be, social and be more active throughout high school. And cross country running, surprisingly, is my pick. And I think what really gets me is the view, running across different
okay.
fields, running
Mm,
through the river, different terrains, and it's just such an easy sport, well, easy sports to
yeah.
pick up. You just need a running shoes and gears, and you're ready to go. You can run it in almost any weather. You can just run it by yourself with people.
Mm,
Um,
mhm,
that's what kind of draw me into it. But yeah, the initial draw is really the scenery.
yeah.
Yeah,
Yeah, cross country is fun and it's
yeah,
very inclusive. I know my son
exactly.
ran
Yeah,
cross country and it's like
that's awesome.
everyone on the team ran. It wasn't like
Yeah.
tennis where you only the top six play or something like
Right.
that.
Yeah.
Everybody gets a chance to run. It's very democratic.
Yeah. It's surprisingly group sports in a sense, and the
Hmm.
running community has been awesome. Especially Boston, we have a lot of different clubs in the city uh, or suburban area. So it's very easy to find a group, just go run. Yeah.
Yeah. So you continued that after high school then and into college and then when you went into your professional career?
Yeah, pretty much. Right now, I've been focusing on slightly different sports, but I still
Yeah.
have races sign up, just to keep me accountable, to keep my habit running. Yeah, but
Good.
sometimes it's difficult. Work changes or life changes, your routine got disrupted,
Yeah.
so then you kind of need to restart everything again. So signing up for races is one of my solution to keep me accountable and it still
Yeah.
keep running. Yeah,
It gives you a goal, but and we'll
for
talk
sure.
about
Yeah,
Beverly's crazy adventure at the end because I think that's super interesting as well. I would love to hear more about that.
yeah.
But tell me about like what was one of your best runs? Like amazing scenery, amazing crowd, energy, everything just kind of clicked for you. What run was that?
I think that would be my first marathon, which is in
Hmm.
Philly last year.
Okay.
It was a little bit chilly, but it was the
Hmm.
crowd support is just so amazing. And I still remember the chicken soup at the end. So
Okay.
that's what that's probably one of the best thing after a race you can get.
Yeah.
But at the time I was just super nervous about this race
Mm,
because
mhm.
I kind of damaged my ankle uh pretty much I think almost at the end of my
Oh
training. So
boy.
almost right after the peak. So I finished the peak part
Yep.
as part of my training program. But yeah, I was running to I think on an easy run, I was just running to a pothole and I
Oh no.
broke my ankle, unfortunately. So I think it took me about like a month or so to recover.
Okay.
So, but I haven't done any like intense speed work, tempo run. I walk a bit, but that's
Hmm.
pretty much it. So I missed pretty much the entire last few weeks of training. So I was super nervous, but it ends up turn out okay. I don't remember what the last 6 mile what I did, but I just
Yeah.
keep running, keep following the crowd.
Sure.
Oh, I remember just people yelling and cowbells everywhere, and some like crazy people take shots and beer.
Oh yeah.
Yeah,
Yeah. I can, I was
yeah.
on mile 21 or 22 of the Marine Corps Marathon
Oh, yeah, that's a good
and
race too,
people
I
were
think.
handing out fireball shots.
Yeah, that's
Um,
something.
yeah. I'm like, this is my first marathon. I'm not going to be crazy and do that. So,
Yeah, yeah. So,
yeah.
but one of my sports club mate, he tried to drink a beer at mile 23 and terribly regret it. So
Yeah.
yeah. Um
So, so what did you join a local sports club?
yes, but not right now. I've not been so active about it.
Yeah.
But it's the Somerville running road runners.
Okay.
Yeah,
Okay.
so they're based in Somerville, but
Yeah.
I moved to Jamaica Plain, so
Uh,
they have their own club. I haven't checked it out yet.
yeah.
So I try to join the club to keep me accountable as well.
Yeah, I love that. So
Yeah.
I belong to Millennium Running
Oh,
up
sweet.
here in New
Yeah.
Hampshire.
Ah,
They put on a number of races, but the club has got about 450 registered members. And you're right about the accountability. It's
yeah.
fantastic because there's workouts once a week.
Yep.
There's a voluntary group runs on the weekend. So
Right.
it keeps you, helps you with your schedule. And so talk to me about your training for the marathon. Did you follow anybody in particular, like Hal Higdon, or did you use the
Yep.
BAA method, or what was the method you used?
House. Yeah, for
Yeah,
sure.
yeah.
It's if it's just so easy to follow, and
Mhm.
I tend to overthink and put everything in spreadsheet, and I found out that didn't really work out. I just need to do it. So I need to follow
Yeah,
a basic simple plan, do it, and that's been work out pretty
yeah.
well. I've been trying to use an app called Runner. um
Okay, okay.
they're acclaimed like AI generated running program depending
Oh,
on your current pace and your goal, and you set out a program for you to reach towards that goal. So I've been trying the app out a little bit.
okay,
Um, this is like my third days actually. So I've been hearing positive things about it. So
okay. And
yeah.
what's it called again? Run AI?
Uh, Runna, I believe. Runna.
Oh, Runna. Okay,
Yeah.
okay. Yeah, yeah. I've heard of McRun, which is where you can
Oh
put in
yeah,
your
that one
yeah,
too. Yeah.
yeah. But I don't think it's AI based. So I'll have to try this Runna. I like the name too. It's such a New
Yeah,
England name. It's like
I
lunch,
know.
you know. Oh,
Yeah.
chowder.
Yeah, I found it exercise a little bit. I think they're trying to push a little bit more. So that's just
Mhm.
how I feel, but it's only third
Yeah.
days.
Okay.
Yeah.
Good. So have you signed up for any runs, any upcoming runs?
Yes, next week.
Oh, what do
Oh,
you?
actually no, this weekend. This Sunday.
Oh, okay, cool. Which one
Yep.
is it?
That's BAA 10K. So they have
Oh,
the
running.
running
Yeah.
medley series, so
Mhm.
5K, 10K,
Yeah.
and I believe half marathon near the end of the year, like November.
Yeah.
Yeah.
Yeah. Yeah. They schedule a number of runs. Yeah. Um, and then you had talked a little bit about your first marathon. So there's more than one marathon that you've done.
Yes, my second marathon is not so far from Philly. So Philly is like November,
Yeah.
beginning of November, and my second marathon was this year, January,
Oh, wow.
in Florida. So one of the Disney marathon,
Okay.
um, and that was probably one of my worst run ever.
Yeah. Yeah. Did
Because
you
I
feel
was
like, so why was it your worst run? And do you feel like it was too close to Philly for you to have recovered well?
That is actually not a problem, but I was
Yeah.
sick because I went to Universal a few days before, and it was uncharacteristically cold in Florida. I was totally
Mm,
not prepared for it, and I got cold, and probably the amusement park. There's a lot of gym floating around, so I
sure.
caught a cold. So I was fever, and I cannot. I basically just lay on my bed for like 2 days, and then the third day is the marathon, and that's when I
Okay.
feel a little bit better. But I can still feel I have a sore throat, my fever, everything. But I figure I'm already here.
Yeah.
Still gonna try it out.
You paid the
Um,
money. You might as well get to
exactly,
the starting line. Yeah.
exactly.
Yeah.
And it was still very, very cold. I even though I did bring my long sleeve like running gear, it's still super duper cold. And
Yeah.
I was running headwind as well.
Yeah.
And yeah, it just the whole experience is kind of miserable. But it's part of the whole ordeal of marathon as well. And
Yeah.
I pretty much walk a huge portion of it. And but fortunately, I did not get swept, so I did finish it. But
Hmm.
it was
Hmm.
it was not as I expected it turned out to
Yeah.
be. But
Yeah.
yeah.
Well, I think a friend once told me that a third of your runs are really ugly, bad.
Yep.
A third of your runs are okay, and a third of your runs are great, right? So
Yep.
I guess you're gonna have to run another marathon and kind of see where it all shakes out, right?
Yeah, yeah, I'm
Yeah.
planning to take a little bit break on marathon as a focus
Yeah.
on something else. So, but I just been doing a little bit half, trying to
Mhm.
get a little bit faster, build the strength on my ankle. I can still feel a little bit uh on my ankle as
Yeah.
well. It just the range of motion is not as good as before. Uh,
Hmm.
so I'm just trying to focus on the shorter races and hopefully one day I'll re return to marathon again. Yeah.
Well, if you come up here to New Hampshire, there's a really fun run at the end of the summer, or maybe it's I think it's like second week of August, but it's the New Hampshire 10 miler. It
Oh,
used to be a
okay.
NHTSA, used to be a registered run, track and field run, but it's not anymore. And it's the last one. After this year, they'll discontinue it. But it's just a ton of fun. It's a
Hmm.
nice course. It's challenging without being just way too much. And it's just a ton of crowd support and a lot of people running it. So if you're looking for a 10 miler, that would be perfect.
Okay, we'll check it out for
Yeah,
sure. Yeah,
come on up to New Hampshire.
we'll do.
Um, so let's talk a little bit about gear. What kind of
Hmm.
shoes do you run in?
Right now, I've been swapping between Brooks and Saucony.
Oh,
I
really?
started with Nike, but I feel like Nike is a little bit tighter on my sh on the shoe box. Just
Hmm.
yeah, so I switched different platform. I like both so far.
Hmm.
I've been I've been running with Saucony Ride for a bit. It's more like a stability shoes.
Hmm.
Um, and the new ones I got is a Brooks Ghost. I got a huge
Oh,
recommendation from my colleagues about
yeah.
this,
Yeah, I've
so I'm
heard a
excited to
lot of
try it
good
out.
things about the Ghost. Yeah.
Yeah, yeah.
Yeah.
So yeah,
Yeah. I heard it's a nice ride. So,
yeah, exactly.
what about other gear? Any other favorite gear? Watches, headphones, that help make you run
Uh,
easier?
Watch it is just very simple. I use Apple Watch.
What
So,
do you?
I a lot of people convince me to get into the Garmin, but I
Gotta
feel
get a
like
Garmin, man.
I
Yeah.
yeah, that's part of my plan, the next
Yeah.
step, right?
Yeah.
And the Apple Watch, especially for marathon, it just doesn't last. Well, yeah, it lasts, but
Yeah.
you gotta keep be careful with the batteries and all that. And the Garmin just so much better in terms of like data recording and just so much more accurate.
Yeah,
Um,
and and I can download all my metrics and I can
yeah,
track my cadence improvement over time and my heart rate and all that stuff. And I do track everything in a spreadsheet because I'm one of those kind of nerds.
yeah,
But it's always fun to see a progression.
yeah.
Yeah.
And the rest is not so much. I like really light t-shirts, a very
Yeah.
breathable t-shirt, running belt. I don't usually run with water.
Okay.
Um,
Okay.
and yeah, that's pretty much it. Shoes is probably the most important. Sometimes I
Yeah.
will wear like cap or something and
Yeah.
sunscreen and
Yeah, of
um,
course you need the sunscreen. I mean, my dermatologist friends would chastise me if I didn't wear my
yeah,
sunscreen. But
exactly. Yeah,
yeah, and most people are really passionate about the shoes because
yeah,
that's really their kind of intersection with gravity and with the earth, and it's really a personal relationship that you have with your
yeah,
feet and with your running style and with the ground, and it needs to be right.
yeah. Socks too, to be honest.
Yeah.
Socks as well.
Yeah. So that's kind of interesting. I got some compression socks, and are you referring to compression socks, or referring to a certain style of sock?
Um, I like a little bit support, but
Okay.
not too compressed. I'm
Yeah.
also experimenting on what kind of brands I
Hmm.
should try. I go to like Marathon Sports, they have a variety of things. I
Yeah.
usually just I'm still in the trying out phases. I know some people they just have one brand they consistently run throughout their whole entire running career. I know one guy only run with New Balance. There's nothing else. He would just
Yeah.
run New Balance. So I'm still trying to figure out what's the best platform for me. Same thing with socks too. But
Yeah.
I don't think I mind compression socks.
Hmm.
Yeah.
Yeah. Yeah, and I'm not passionate about socks. I tried the compression socks just because I was into like getting whatever gear I felt would give me an advantage. And I didn't feel like
Mm.
the compression did a whole lot, although they helped keep my calves warm during the winter. So that was
It is,
good.
yeah. Yeah.
But you're right about the shoes. And I started out being really passionate about Hoka, and I still am. I still run in Hokas. I haven't found
I
anything.
haven't run one of those yet. Yeah, that's one of the brand I really want to try it out. I
Yeah.
heard a lot of good things about it too. Yeah.
Yeah. So, but I've tried other models. I just haven't liked them as much as I like the cushioning feel of the Hoka. So,
Yeah. Yeah.
but yeah. Okay. Last couple questions. But I wanted to think about
Mhm.
or ask you about what you think about when you do your long runs as you're prepping for a marathon. Do you spend the time kind of trying to tease apart a problem that you have at work or with the science or with or maybe you're just looking at the scenery, but what do you think about when you run?
I think it involves all of the above. It depends
Yeah,
on the day.
yeah.
But if I do remember one of the runs I did try to solve a work problem. So during my daily work, I do root cause analyses,
Hmm.
and we just have this huge complex spreadsheet. So, and I was running the Jamaica Pond. One loop is like about 1.2 miles.
Oh, cool.
So I kind of just come up with a plan. Hey, start of this loop, I will focus on this root cause, right? And then I would
Okay.
just walk through all the scenario on the run.
Yeah.
And then after I finish the loop, I write the notes on my phone and walk a little bit. And then just start a second loop for the second root cause, and so on and so forth. And until I go through all the root cause, it's just like, oh, I already got 7, 8 miles in, man. And I would just like walk a little bit and just type on my phone, trying to write a conclusion. And then I would do a few more loops just to think of nothing or just
Uh,
enjoy the scenery. And then
yeah.
kind of just let it sit a little bit. And when I go
Hmm.
home and the next day go to work, I would just compile all my notes. And that works out pretty well. Like it's a switcher kind of thing.
Yeah.
You play with your mind, and sometimes you just brilliant idea comes out after exercise.
Yeah.
Yeah,
That
or during
that's
an exercise.
fantastic. I
Yeah.
that's almost like when you hear about people writing down their dreams, right? But you're
Yep.
actually methodically, thinking through an exercise to get to what is causing these problems in
Yep.
manufacturing, taking notes, coming up with a conclusion, and then going to work the next day and take and using it as a jumping off point, right? I think that's very cool.
Yeah. I think it kind of reduce some kind of cognitive fixation. So if you just stare at a problem,
Hmm.
it's
Hmm.
it's not working out, but you just need a fresh perspective. I
Yeah,
think
very
the
cool.
switching movement patterns really help.
All right.
Yeah.
Did you say switching movement patterns?
I guess, yeah, it's like
Yeah.
each loop or like scenery
Oh
switches
yeah.
or yeah.
Yeah, yeah.
Yeah. Yeah.
All right. Very cool. Very cool. Okay.
Yeah.
Well, listen, to finish up, I've got one last question.
Sweet.
Tell us about Beverly's next big adventure. I understand that falling out of the sky is something that you love to do.
Yes, I recently picked up skydiving and I really, really enjoyed it. And
Great.
that's why I kind of steer away a little bit from running and work towards more on skydiving. I think in a lot of sense, I would say it's kind of similar. You need to enter a state of flow, right? Just running is
Hmm.
a little bit longer, and skydiving is just you're there.
Yeah.
And both it's all about mental toughness and the resilience. You have to um, make a decision, and both sports kind of teaches you to um, go beyond your own limitation and kind of demonstrate that you're capable more than you thought. So I've been focused on a little bit more on skydiving and group skydiving competition in that sense. Yeah,
Oh, wow.
yeah,
That's really cool. That's yeah. Um yeah, so one, thank you so much for your time today. I think that's incredible to have conversations like this and I learned something different from everyone that I talked to. And
yeah. Likewise.
it's certainly from our conversation today. some key takeaways for me are just, that absolute discipline, that thought process that you bring to running. And I think that something you mentioned really resonated with me, which is that grit, right? Having the discipline to be able to do the training and approach that gives you that. I think it gives you something a little extra from a discipline thought process perspective that bleeds over into other aspects of our life. So
For
I
sure.
really
Yeah.
appreciate you sharing your journey with me today.
Yeah. That's awesome. Thanks, Steve.
Yeah.